Artificial Intelligence Dr. www.abcpharma.net/English. User question. Cardiac-related causes of extreme tiredness in elderly individuals who have a unicameral leadless pacemaker, despite sleeping well for 8 hours. GPT-4o answer. Extreme tiredness in elderly individuals with a unicameral, single-chamber, leadless pacemaker, despite sleeping well for 8 hours, can be attributed to several cardiac-related causes. Here are the primary ones. Cardiac-related causes. 1. Inadequate pacemaker settings. Improper pacing rate. The pacemaker may not be set to the optimal pacing rate for the patient's needs, leading to suboptimal cardiac output. Sensitivity issues. The device may not be adequately sensing and responding to the heart's intrinsic activity, resulting in insufficient support during periods of low natural heart activity. 2. Pacemaker syndrome. Loss of AV synchrony. In a unicameral pacemaker, the lack of atrioventricular AV synchrony can lead to pacemaker syndrome, where the heart's chambers do not contract in a coordinated manner. This can reduce cardiac efficiency and lead to symptoms like fatigue, dizziness, and palpitations. 3. Heart failure. Reduced cardiac output. If the patient has underlying heart failure, the heart may not pump blood efficiently, leading to reduced oxygen and nutrient delivery to the tissues, causing fatigue. Fluid overload. Heart failure can also lead to fluid retention, which can exacerbate symptoms of tiredness and fatigue. 4. Bradycardia and chronotropic incompetence. Persistent bradycardia. Despite the pacemaker, some patients may still experience episodes of bradycardia, slow heart rate, if the device is not appropriately set or if there are issues with its function. Chronotropic incompetence. The inability of the heart to increase its rate adequately in response to physical activity can lead to fatigue, especially if the pacemaker does not adequately compensate for this. 5. Arrhythmias. Atrial fibrillation. Even with a leadless pacemaker, patients might experience atrial fibrillation or other arrhythmias, which can cause inefficient heartbeats and result in fatigue. Ventricular arrhythmias. Abnormal heart rhythms originating from the ventricles can lead to decreased cardiac output and fatigue. 6. Myocardial ischemia. Coronary artery disease. Reduced blood flow to the heart muscle due to blockages in the coronary arteries can cause ischemia, leading to fatigue even if the patient does not experience chest pain. 7. Valvular heart disease. Aortic stenosis or mitral regurgitation. Conditions affecting the heart valves can lead to reduced cardiac efficiency and symptoms of fatigue. Recommendations for management. 1. Pacemaker checkup. Regular follow-ups to ensure that the pacemaker settings are optimized and functioning correctly. 2. Comprehensive cardiac evaluation. An evaluation by a cardiologist to rule out other underlying cardiac conditions, including echocardiography, stress testing, and possibly coronary angiography. 3. Monitor and treat arrhythmias. Continuous monitoring for arrhythmias and appropriate treatment if detected. 4. Medication adjustment. Review and adjust medications to optimize heart function and manage conditions like heart failure or ischemia. 5. Lifestyle modifications. Encourage a heart-healthy lifestyle, including a balanced diet, regular moderate exercise, and avoiding tobacco and excessive alcohol consumption. 6. Regular monitoring. Ongoing monitoring of symptoms and regular consultations with a healthcare provider to manage and adjust treatment as needed.